I started looking at the position, and I definitely had some questions about the job description. So I reached out personally to the hiring manager. Her email was listed on there, and I was like, hey, I'd love to chat. Like, I have a couple questions about this job description. Like, here are some times that I'm available, and like, let me know, and I'd be happy to, get this set up. So I just went ahead and reached out to her, and she reached back out and said, yeah, let's do it. So got on like a 30-45-minute conversation, and then I was like, okay, I think I can do this. Like, I like this job. It's kind of bringing in lots of different skills that I have. So I went in for an in-person interview probably in March. I applied for the position probably in February. And then by the end of April, I was offered the position, and I started the day after graduation.
Welcome to the Public Health Millennial Career Stories Podcast, episode number 14. Hi, everyone. My name is Emory Richards. Thank you so much for joining me today. I really appreciate you taking your time to watch or listen to this episode. I would really appreciate it if you shared this with a friend, someone who you think might get some value out of this. I would really appreciate that. Other than that, you can review, subscribe, like, comment, give me some feedback or who you'd like to see on the show, and I would take that, and I would try to reach out to that person, or just hear what different kind of stories you want to listen to or industries. I know on my next couple episodes, I have a couple different guests who have different walks of life. So definitely stay tuned and subscribe if you haven't yet, so you won't miss out on those episodes. Other than that, this episode has a lot of value. I just want you to pay special attention to how this guest got her Orise Fellowship, because this is something that I talk about all the time. And if you're a public health student, definitely pay attention to this, because this is something that is not utilized enough. So just pay attention to that. And without further ado, here's today's episode. Enjoy. This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. I'm happy to have this person on today. They have founded an Iranian nonprofit memorial foundation, Akbar Rasteagr Foundation, focused on pediatric cancer while being a sophomore, getting her bachelor's in microbiology from the University of Georgia. She then went on to complete her MPH at the Rollins School of Public Health at Emory University. During her time as an MPH student, she held leadership positions, one example being an Office of Career Development Ambassador at Rollins School of Public Health. She has also completed a CDC Orise Fellowship in the Division of Influenza during her MPH. She graduated in 2019 and currently works as a consumer engagement consultant at Humana. We have Yasmin Kashfipour, MPH. Welcome to the show, Yasmin.
Thank you. Thank you for having me.
My pleasure. Yeah, I'm really happy to have you on too. So how have you been doing?
I'm good. I'm just taking it a day at a time, and everything's been good.
Okay, well, I'm glad that you're very optimistic and everything's been going well. I guess how you've been coping during like this change to everything that's going on right now?
Yeah, so I'm definitely fortunate that I have my family very close by, and I have my significant other close by too. So I feel like it hasn't been too much of a change for me. I've still been, seeing my family quite a bit and seeing him quite a bit, but we're just taking it a day at a time. We see what's going on with the world, and we're trying to be realistic, but trying to find the positives in everything.
Okay, that's great. Where are you located right now, actually?
Yeah, so I'm located in Atlanta, Georgia.
Okay, so you're still in Georgia. Okay, cool.
Correct.
Cool. So tell us about your personal background.
Yeah, so my family originally is from Iran, but I was born here in the States. I actually was born in Atlanta, raised in Atlanta, grew up, so I'm a Southern gal at heart, born and bred. I haven't left yet, which is surprising. So maybe in the near future, it is a possibility if the right opportunity comes. But yeah, we've been here and we're loving it.
Okay, well, that's cool to hear. And I guess I've been to Atlanta a couple of times. I really enjoy that city, and I feel like it is a hub for public health in a sense. So definitely interested to hear what you think. So what does public health mean to you?
Yeah, so public health to me definitely means helping people live their fullest and best life. And there's so many different concentrations in public health, from epidemiology to behavioral and community health and environmental health. So I really love the fact that all of those components and sectors kind of come together and each contribute to the health of our communities. And then also with prevention, I think, taking charge of our health and really early on before, serious health outcomes come into play. So I think public health encompasses pretty much everything, and all of that together really does affect the health of our communities.
Yeah, absolutely. And I like how you said taking charge of our health, because that is very important in a lot of aspects. Like, health is affected with so many different things. So we definitely have to know what to do in all these different aspects and take charge of it and try to get those best outcomes. So where does your public health journey begin?
Yeah, so my public health journey actually began towards the end of my college career. And it was one that was a very windy road, but one that was super rewarding. I changed my major many times in college and started out as chemistry, then went to biology and English and political science. So I tried the whole spectrum, which I loved. So, taking different classes definitely taught me what I liked and what I didn't like. And when I started working in a research lab, that's when I really, liked the sciences, and that's kind of where I went into. And then eventually I was like, well, someone recommended me take a public health course. So I was like, oh, okay, I'll take one. And I ended up falling in love with it. So I was like, this is I just fell in love. I know this is where I want to go.
And that's awesome. I'm glad to hear that. And so you went into college being a microbiology major.
Mm-hmm.
What was the thought behind that?
Yeah, so like I said, I changed my major a lot of times. I came in.
How many times, can I ask?
I think probably 6 or 7 times. So
Okay.
I was definitely at the point where I was like, wow, I don't know if I'm going to graduate. I may be a lifelong student, which I love school. So I think the hardest thing through that process was I loved so many different things and I loved learning. It was kind of hard to narrow down exactly what I wanted to do. So I started out in chemistry and in the sciences, and then I switched for a little while, and then I started working in a research lab. And when I worked in the research lab, I worked in a veterinary lab. So I worked with, animals all day long, and we worked with different viruses and bacteria. And I was like, oh, this is really cool. I'm sitting in a lab and I'm pipetting everything, which is fun, but learning, how disease transmission works and the pathogenesis of viruses and bacteria, it definitely intrigued me. So that's when I ended up choosing microbiology, and learning more about bacteria and viruses kind of feeds in a little bit more to the epidemiology of public health.
Okay, and that makes a lot of sense. And that is a lot of major changes that you had there, 6 and 7. I think the average is 4 major changes, so it's not that big of a deal. And I think the North American education system it's shaped in a way that you're able to do that and still come out on top. But that is very interesting to hear. You don't hear many people with that many majors, but good for you. You probably learned a lot of different things.
Yeah, it was great. I'm so happy I graduated in 4 years, and it was definitely a surprise to my parents, but I think everyone was pretty happy at the end of the day.
Okay, very awesome. And what was that lab that you did in your senior year that really got you into wanting to do public health?
Yeah, so in the veterinary lab, we worked with, like I said, lots of different diseases. I worked specifically on West Nile Valley fever virus, but I worked also really closely with influenza. So I think the fact that I wanted to understand how disease transmission worked, not only in animals, but also how that kind of transmits and translates into human behavior and human disease, was something that I think, obviously in the world we live in today, science is so important, and kind of translating that into healthcare was something I was so curious about. So that's kind of how that scientific background of mine kind of translated into the public health side.
Okay, awesome. Was that more like science, like inoculating bacteria and growing cultures and that kind of thing?
Correct. Yeah.
Okay, awesome. So I guess Actually, because we didn't talk about this, like in your sophomore year, you started a memorial nonprofit in memory of your grandfather that passed away from cancer, if I'm
Mhm.
correct.
Correct.
Okay, so that's Akbar Rasteagr Foundation. So tell
Yeah.
us about that entire process of starting that nonprofit. Because in your sophomore year, that's pretty impressive. Like a lot of people don't even have nonprofits after they graduate.
Yeah, so that was definitely a process. Definitely while I was in school was not easy, but I had a lot of help from my family. So I come from a very humanitarian background in my family. I always think that that kind of contributed to my public health interest as well, is kind of going out to my community, being very involved in the city of Atlanta, or even just like the Persian community that I come from. So definitely an aspect of that was having my family help out with the foundation and the establishment of that. So since this is a foundation in another country, I couldn't be there in person. Since I couldn't be there in person, I definitely had to rely a lot on my family to help the establishment process of that. So my mom would go back, my dad would go back, we would talk with sponsors from here that were all the way in Iran. And we'd really just try to come up with ways we can work together in order to address pediatric cancer, especially in the country of Iran, where healthcare is not as advanced as it is here. The medicine is not as advanced. You go into a hospital over there and people are usually doing surgeries just in a regular hospital room and not a surgical room. So definitely, in a third world country, if you go out there and you see how healthcare runs, it's a tragedy. It's so hard to see. But something we wanted to address with the foundation was making sure that children that were fighting cancer weren't having to worry about anything other than their health. They just had to worry about getting better. And obviously, I'm not a parent, but having a child with cancer, I can only imagine, puts a toll on the parents emotionally and mentally and physically as well. So we wanted to make sure that the parents, had some kind of relief financially. So any donations that we raised were put forward towards the kids, treatment options, whether it was chemo or radiation, medications, even a place to stay. The hospital beds, even in America, are very expensive per day. So having a place to stay, a lot of the parents would just sleep on the floor of the hospital room, which just is heartbreaking. So we do a lot of different things with the foundation. Some of it goes towards research. Some of it goes towards, anything the children want with regards to making them as healthy as possible for, chemo, radiation, and all those other things.
Okay. And was this a driving force, like just for you, or was it like your family coming together and say, okay, let's do this together, or were you the pushing force to do this?
Yeah, so this was something my grandfather and I actually talked about, and I guess when I was growing up, we really bonded over giving back. So my grandfather was actually an orphan, and children, his childhood was very difficult, but he absolutely loved children, whether it was his grandchildren or great-grandchildren. It was just his passion. So it's something that I had discussed with him beforehand, and he wanted to do something, but he didn't know what. And then after his passing, I sat down and thought about it. I was like, you know what, I can really turn this into a positive thing. And I made this foundation, and I brought the idea to my family. I was like, this is what I want to do. This is how I want to do it. And, are you guys willing to help me kind of establish this, since half of my family is still back home? It was easier to have them over there to kind of help with that establishment too. So it was definitely I think a year's process, many, many years, but it was something that it was a family effort for sure.
Okay. And that is awesome. And congrats on starting that up and getting that rolling and helping out those people who need that help and just need that support. So if people wanted to make donations, can they still make donations, and how can they do that?
Yeah, absolutely. So there's a GoFundMe page. It's been on there for years. So the foundation started in 2014, but the GoFundMe page is still open. So if anyone wants to donate, that would be greatly appreciated. Every year we send donations. Obviously, with the way COVID is right now and travel is not encouraged, we're sending everything electronically. But the years that I get to go back and hand deliver it, it's very rewarding. We get to sit in the hospital while kids are are getting treatment, and, we hold their hand, we bring them toys and goodies and things like that. So it's such a great process, and it's great to see firsthand who we are changing their lives for. So I really love it.
Yeah, awesome. And where would people be able to find that GoFundMe page specifically?
Yeah, sure. So if they just Google the Akbar Rasteagr Foundation, it should come up, and they'll be able to go on there and just donate.
Okay,
Really
great.
easy.
Great.
Yeah.
And I'll make sure to find that and put it in the show notes for anyone who wants to find it.
Sure.
So you said you did your undergrad in microbiology, and you said you found this love for public health. So why did you decide to pursue an MPH over like a MSPH?
That's a good question. So for me, I feel like a lot of people, especially that go into college and eventually love the sciences, a lot of them eventually want to go into some kind of professional program. I know I loved school enough to continue, so that was definitely not a question. But, for some time I was definitely battling, wanting to pursue my, I was going to be a dentist. I wanted to go to dental school in the beginning. So I never actually thought about an MSPH. I definitely knew it was more the science, the research side of things. I knew eventually I wanted to get more into the practice side of things. So I think that's why I chose an MPH over an MSPH. But, there was a time where I definitely didn't see myself in public health. I wanted to go down a different path. And then I eventually redirected my path, and it led me down an MPH.
Okay, and I think that's very common. Like a lot of people do not go into college wanting, okay, I'm going to be a public health professional. I think it definitely comes along the way, some way or another, which is really cool to hear all the different ways that people do. So, why did you choose to go to Rollins School of Public Health at Emory?
Yeah, so that's a good question. I think there's many reasons. I think Atlanta being one of, like you said, being a public health hub. I was very lucky that I'm from here, so it made it very easy for me. There was not really a transition period of moving and things of that nature. So that was great. I knew with the CDC being here and lots of great public health organizations and agencies, I had so many opportunities to get out there and see what I wanted to do. So I think that was a big one. The other reason is I definitely knew that the professors and faculty at Rollins had such a reputable name out there, and they were doing such great research, and they have these are people that have been in the public health field for 30-40 years and are now teaching the next generation of public health professionals, and I just knew I wanted to learn from the best of the best. So I think those are the main reasons why I chose Rollins.
Okay, and that makes a lot of sense. What was your concentration, and why did you choose that concentration?
So my concentration was behavioral sciences and health education, and I chose that concentration mainly because after my undergrad, I was trying to get a little bit away from the heavy sciences. I did come from a very heavy science background, and I understood how, the science background can contribute to public health, and it's, in times like these, it's very necessary. But I was really curious about the behavioral aspect of public health and how human behavior can really contribute to health outcomes. So I definitely chose the behavioral sciences and health education for that. And the great reason is that the behavioral sciences was more of the research side of things, and then the health education was a little bit of the community side of things. So I felt like I had the best of both worlds.
Okay, and that sounds like a great combination. So for myself also, I did my bachelor's in biology. So I came from a very science background before I went into public health, and I didn't want to choose a biology focus like public health. So I didn't choose epidemiology. I chose health management and policy. So do you think having that like biology background and just like having to study for those types of exams have helped you throughout your MPH program?
I think so. I think the heavy sciences were definitely helpful in my epidemiology classes that I took. I think it gave me a deeper appreciation for public health. But my program was very practice heavy, which I really appreciated. You would learn in the classroom, but to be able to take what you learn in a classroom and apply it in the real world was what Rollins really focused on. It wasn't necessarily about studying for an exam and taking an exam and getting a good grade. It was more so like, can you take, this lesson and be able to apply it and do a community needs assessment or do a program evaluation? If a organization comes to you and says, hey, we need help, like there's a need in this community and we need help addressing it. So I would say the science has definitely helped in like my biostatistics courses and my epidemiology courses. But I felt that my very community-based classes were very practice-based. And I really enjoyed those as well.
Okay, and I like that a lot. For me, it was sort of a challenge in my MPH program because I was focused on like practice, and then a lot more people focus on like research and that kind of stuff. So it was a struggle, and that kind of is the reason I have this platform now, because I asked questions and didn't really get those answers. So I'm glad that you had that in your school, and you had a lot of professors that were supporting you do that. So just give me one example of taking those like lessons and applying it to real life situations.
Yeah, so for me, for example, in my job every day, as a consultant, I go out to lots of different communities. Typically in a non-COVID world, we travel out to lots of clients, and I will go out to my communities and I'll do a needs assessment constantly. So every company is different. They have different types of employees. The demographics are different. The backgrounds are different. So I have to constantly go on to different communities and do a needs assessment every time I have a different client. Some clients are very white collar based, and maybe they're a little bit more tech savvy. Maybe they're a little bit more health conscious. Whereas I have some clients that are more blue collar and they may not be as tech savvy or as health conscious. So I have to approach each community differently, and I have to look at the needs in each community. One community may have, needs with regards to trying to, like decrease cancer rates, or one community may want to work on like metabolic syndrome and trying to prevent diabetes. So there's different needs, and I will have to constantly go through the communities and do a different needs assessment. So I would say that was one course I took in my graduate school career that really helped me with my current job. And it's very practice focused and something that I struggled while I was in school, but it's like second nature now.
Yeah, absolutely. And I think that's hugely important. That's another thing, like community health needs assessments. That's one class that I took. And then my professor was the person that I precepted for. And then my fellowship that I have now was primarily based on someone who can do community health needs assessments. So I was really fortunate to be able to build that skill and have it. So I'm really happy to have that. So you got an Orise Fellowship with the Division of Influenza. So why did you want an Orise Fellowship, and what was the process like applying for that?
So an Orise Fellowship, like most fellowship programs, they're training fellowships. And I wanted an Orise Fellowship just to get more experience in federal government. So I know with Orise Fellowship, they have State Department positions, they have CDC, any federal government, NIH. So since CDC was close by, I wanted to be able to get some kind of experience with the CDC and the federal government. So I actually ended up speaking to a mentor that I worked with in my research lab who ended up getting a job with the CDC. And I just expressed to him I was really interested in getting some government experience and, any kind of thing. I didn't have a specific interest that I was looking to go into at that point. And he told me that he knew someone in the flu division. And since I had worked in flu in my undergrad, I was like, oh, that's perfect. Like I have a little bit of experience there, so I can definitely go in with some level of background. So I was able to connect with that person, and, she told me, oh, you should apply for a fellowship. So I went online and I applied for an Orise Fellowship. And then I think about a month later is when I heard back and they offered me a fellowship. It does take some time to kind of get a response for those, but once I got it.
Was there like no interview process, just you submitting like an application?
Yeah, I think for me, because I knew I had those connections, I don't think there was much of an interview process. There probably should have been. I think I did talk with like the leads and the supervisors and things like that on the team. I did go in one day for lunch with them, and I guess it was a very informal interview. So yes, not a very, over the top federal government, let me suit up kind of interview. Very informal, but it was good.
Yeah, and that's awesome, and I'm glad that you made those connections to get that informal interview to get you that position. So what did you do in that position, and how long was that fellowship?
Yeah, so I started that fellowship at the end of my first year until the end of my second year. So right as soon as graduation hit is when I went ahead and stopped my fellowship. What did I do? So I was very similar to a project coordinator. As an Orise Fellow, they don't really give us titles. They just say you're a fellow. But I worked on a lot of different things. I worked on our U.S. flu VE vaccine effectiveness team. So we were evaluating the vaccine effectiveness for flu in the United States on a yearly basis. And we had different institutions that we obviously, as the CDC is a federal organization, we gave funding out to conduct that research with us. So I was in charge of a lot of statistics and numbers and a lot of SAS, and definitely going in and updating our flu websites and making sure that everyone had current numbers out there with regards to what's going on in the whole world with flu.
Okay, and yeah, that's very important data and stuff that you're doing there. So did you find it difficult to take, like, I guess, the class SAS work that you did and convert that into actual SAS work?
I think when I took the class on SAS, I definitely struggled a lot. It was not my favorite at all. But when I, again, was able to put it into practice, it really helped a lot. I would definitely make lots of mistakes, but I definitely told myself to ask questions. And if I didn't understand something, either to look it up, I had my biostats book, or to ask a colleague and write it down. I'm definitely someone that loves to write things down and learn from the process. So I think over time, just doing it repeatedly and putting myself in those kind of situations where I had to do SAS and let me play around with this, let me play around with that and learn this, it definitely got a lot easier.
Yeah, and I think that's a common theme. People definitely who I've spoken to don't find SAS to be very easy at first, but you definitely have to put in that effort to learn it up front.
Absolutely.
Yeah. So you also had a position as a radiology clinical research assistant. Who was with that? Who was that position with, and how did you get it?
Yeah, so that position was with Children's Healthcare of Atlanta, is one of our top pediatric hospitals here in Atlanta. And I worked in the radiology department. So we worked on clinical trials. So I worked with lots of different, doctors and surgeons, and we had a whole clinical trial team that was dedicated to their studies, managing their studies, making sure everything was approved, making sure they had funding if it was a prospective study. We had to make sure the funding went through, whether it was from a private sector or from federal or state governments. So that was, learning the funding process of how research is. And then again, with the managerial experience, kind of going through that institutional review board process, submitting a study, coming up with proposals, laying down all the criteria, especially when it comes to clinical trials. They can be pretty extensive. So that was a process. And then, just working with these physicians and in recruitment process, going out to these children and their parents and asking them if they would like to be recruited for a clinical trial, if it was a prospective study. Obviously, the retrospective ones are easy. We kind of go back and we look at the imaging that is used, whether it's an ultrasound or an MRI or CT scan, and we look at different things. So if it was a brain tumor, if it was some type of cancer or some kind of rare disease that they were trying to do some research on. So lots of different things with that job, and it was very fun and taught me a lot about the research process.
Okay, and I'm glad that you got that experience. So you also had a lot of other different roles during your MPH. You were secretary. You worked at the Office of Career Development as an ambassador. So how did you balance all of these things while also doing your MPH and having these different roles?
Yeah, that's a good question. I think I'm someone that I really like to be involved in a lot of different things. It's very hard for me to sit still, but it's something I enjoy. It keeps me on my toes. It keeps me learning. It keeps me curious. And I was able to network and meet more people, and that's something I really enjoy doing as well. So I was able to kind of learn through the process. I wanted to be able to not spread myself too thin with any specific activity I was doing. So making sure I devoted enough time. I was very proactive. I wasn't really much of a procrastinator. And giving my 100% to everything was just what I made sure to do.
Yeah. And talk to us a little bit more about networking that you have done to build up all these relationships. Because as you said, you got the Orise Fellowship through networking. So tell us how important that has been for you in your career.
Oh gosh, that's everything. I would network all day long when I was in grad school, and some of my classmates would make fun of me. I'd go right after class and I'd have a lunch meeting with someone, and then I'd go back to class. And I think it's so important. Some piece of advice that they always gave us was that public health is such a small field, so you never want to burn a bridge. So you want to keep building this bridge and making it bigger and bigger and bigger, and having a positive name for yourself. So when people say like, oh yeah, I know that person, they do such a great job. So I think networking is something that it can bring you a lot of great opportunities. So I think people should definitely take the time, invest the time in doing networking, whether it's during your graduate school career or even afterwards. It's still very important.
Okay. And what advice would you give to someone that, let's say, they are trying to network, but they're kind of scared, shy, whatever the case might be? What advice would you give them?
My advice would be that they were probably once in your shoes. I always tell myself, because I get in that position too, where I get a little nervous or intimidated to talk to people. But I tell myself that that person has something that they can offer me that I really want to learn. So always surround yourself with people that have something that they can offer you, whether it's a skill or a piece of advice or, guidance of some kind. Surrounding yourself with that will just allow you to grow more and more. So I try to see it as a learning opportunity and give people a gentle little nudge. But I would say they were probably in your shoes once, so you have nothing to lose.
And that's a great way to view it. And how would you suggest someone does reach out to someone if they wanted to like go for coffee or something like that? What's the best way?
Yeah, so there's lots of different ways. I think it kind of depends on the situation. If you know someone that also knows someone, maybe reach out to that, middleman and try to get something set up, like I did for my fellowship. Or if you're someone that, when we were in Rollins, we had a mentoring program, and you have an email address, send a quick email introducing yourself and just say, I'd love to grab some coffee and chat a little bit more about what you do, or I'm really interested in this. Whether it's a phone conversation. I just think when it comes to reaching out, as long as you say you're interested in something, most people are definitely willing, especially in public health, willing to help and listen and offer feedback and guidance and things like that.
Yeah, absolutely. And one thing that people don't think about, like if you're asking someone to talk with them and like just hear about their story and their career, people are always happy to talk about themselves.
Absolutely.
So definitely just reach out and do that. So during your MPH, you said during your last year or your second year, you were an Orise Fellow, an Orise Fellow. And so after you graduated, you got your job as a consumer engagement consultant with Humana. How did that go about, like having that job, and were you actively looking for that before you graduated? Did you get that job like a while before you graduated, or just towards right before you graduated?
Yeah, so I'll say that one was not through a connection. That one, I was definitely in the job hunt. I will say I'm someone that I started pretty early in my job hunt process, just because, from students that were in the year above me were saying, oh, you need to start early. Like, it's very hard.
And how early did you start?
I started my first semester of my second year. So like right when I became a second year, I went ahead and started.
Same.
I wasn't like very I guess, actively looking. I was just kind of saying, what's out there? Like, let me see what's out there. And I applied here and there, and I was like, oh, let me just get used to some rejection here and there. It's okay. It's inevitable. So I did that for a while. And then I got to second semester, and I was like, all right, this is not good. Like, I need to start looking more seriously now. And it was definitely discouraging. There were definitely jobs that I looked at and I was like, oh, like, I love this. Like, I would be a great fit for it. And I would get through the interview process and I just it wouldn't be the right fit for me, which is fine. So when this position actually kind of landed in my mentor's lap through school. So we had, faculty mentors, and my faculty mentor, send it out to our department, but she sent me an email. She's like, I think you'd be a great fit for this one. So I took a look at the job description and I was like, this seems like a very sales role, like very business role. And crazy enough, I was actually looking for something in the middle between business and health, like a little bit of the middle of both sectors. So I was like, okay, let me take a look at it. Like, I have nothing to lose. So I started looking at the position and I definitely had some questions about the job description. So I reached out personally to the hiring manager. Her email was listed on there and I was like, hey, I'd love to chat. Like, I have a couple questions about this job description. Like, here are some times that I'm available and like, let me know. And I'd be happy to, get this set up. So I just went ahead and reached out to her and she reached back out and said, yeah, let's do it. So got on like a 30-45-minute conversation. And then I was like, okay, I think I can do this. Like, I like this job. It's kind of bringing in lots of different skills that I have. So I went in for an in-person interview probably in March. I applied for the position probably in February. And then by the end of April, I was offered the position and I started the day after graduation.
That is awesome. That is awesome. Congrats. Congrats.
Thank you.
That is truly awesome. But wow. So there's a couple of things I wanted to touch on there. So I like you started looking at jobs and applying to jobs my first semester of second year, and I think it's just as you said, it's like to get used to rejection and just like get a feel for what's out there. And I saw the same things with the MPH class above me. Some of them are like struggling to get jobs, so it's definitely like, look, let me get on this early. I liked that you reached out to the hiring manager. That's something that not a lot of people do, but it is like, it's fine to do. I know my sister did it recently. Like, she had a job interview and they have the information there and you can reach out to that person and create that bond and let them know that you're actually interested. So that, kudos to you for that. And look where it's gotten you. That's awesome.
Yeah, that's what they're there for. Most of the time, I feel like people fear reaching out, but that's, why they include their information on there and they want to hear from people. And again, I think following up, really helped me get this job, because my job, now that I'm in the role, I see that follow-up is such a crucial part of it. So the fact that I reached out and I was, being bold and I put myself out there, and then I was able to follow up after each conversation, say, thank you so much for taking the time. And, I look forward to talking again, and kind of reaching to the recruiter and this party and that party. So I think constantly following up and, expressing your gratitude, it really goes a long way.
Yeah, and I absolutely love that. that says a lot, and it definitely does go along when people do like point that out, that, oh, that person actually took time to like reach out and say thanks for this. And even if you like just mention one thing that you spoke about in the interview or something like that definitely goes a long way. So
Absolutely.
you said that you were interested in like business and health, and this role was perfect for you. So what is this role? First of all, what is Humana, for no one that knows what Humana is?
Yeah, sure. So Humana is a health insurance carrier. So just like the Blue Cross Shield of Atlanta or Anthem, or Cigna or Aetna or Kaiser, or like all the other medical insurance carriers out there, Humana is a medical insurance carrier. But, I used to think of them just as a carrier, but now that I've been with the company, I'm learning how much they actually do, just besides providing people with medical insurance, or insurance in general, whether it's dental insurance, vision insurance, life insurance, all types of insurance. So this role that I currently do, I am a consultant for a wellness program that they have embedded as a package when you buy the medical insurance with us. And this wellness program is, like I said, it's embedded, so it's free of charge to anyone that has our medical. And upon participating and engaging in the program, I always have to tell people there's a difference between participation and engagement. Participation is, okay, I did it one time. Engagement is you do it and you build that habit, that healthy habit of constantly doing it. So engaging is what we're trying to do. We're trying to engage populations of people in different communities to stay engaged with the program in order to give them positive health outcomes. So I have lots of members that come to me with different health stories. They're like, oh, I lost 75 pounds with the program, or, we found that I had a colon cancer stage 2. We were able to catch it early and take care of it. So it really does target a lot of preventative services, which is good because I feel like a lot of people just neglect just general preventative services, getting your cholesterol and glucose checked every year, getting your blood pressure checked, especially if you're someone that has a history of diabetes in your family, or, high cholesterol, high blood pressure, different cancers, things like that. So we really try to look at everyone at a community level, but also as an individual level, and make sure that they can tailor the program to how they would want to work on specific aspects of their health.
Okay. And talk to me about, like, let's say one of these wellness programs. Just walk me through what that looks like.
Yeah, so this wellness program that we work with is called Go365. And Go365, it's a mobile app. So we don't expect people to be very tech savvy. You can do it online, you can do it on a mobile app, but definitely helps if you're someone who's pretty tech savvy. You would download a mobile app and you would get points for doing simple activities on a daily basis. For example, if you go for a walk in your neighborhood, you'd get points for that. If you go and get your dental exam done, we have a health questionnaire. If you fill out your health questionnaire, you get points. So all of these points accumulate. And, no one likes to do things if there's no incentive involved. So that's how we motivate and incentivize people. So these points accumulate into bucks, and they cash out the bucks for lots of different gift cards and prizes and things like that. So that's kind of the motivation behind it on an individual perspective. And then from a community perspective, I work in commercial group sales, so a lot of my clients are big companies. So these companies will pay for a majority of the employees' benefits. And, these companies will get some kind of relief or discount if these members participate. So from the employer perspective, it's definitely a financial relief. And then from the member perspective, it's also another financial relief, but also like the additional gift cards and things like that is another little fun, motivation and incentive for them.
Okay, that's really cool. That's very innovative, and like, it's really amazing to hear this, because I would have never thought that Humana did this type of work. But it is really nice to hear that insurance companies are doing like this prevention work, and I guess it does save them money in the long run also, while also improving health. So that is really great to hear. So earlier on, you said that you did needs assessments as part of your job. So is that mostly needs assessment with like primary data or secondary data, or how do you go about doing most of that?
It's a little bit of a mix of both. So since we are looking at it from a health insurance perspective, we are looking at like past health data. What did they have any concerning, alarming claims in the past? Was there any diagnoses in the past that we should be concerned about, that we need to look for in the future as well? So it's a mix. We go out, and some of the time they tell us what they're going through. And then some of the time we have to look at secondary data and say, okay, well, this person had a really high, like renewal increase. Why is that? And it'll be, sometimes there were health conditions in the groups that weren't addressed. Sometimes there were high claims. Someone visited a doctor for a specific health concern. So it's a mix of both primary and secondary data, I would say.
Okay, that's cool. Okay, so what do you find most exciting about your role and least exciting?
So most exciting, I would say, is I love traveling out to my clients. So as a consultant, my day-to-day, every day is completely different. Right now during COVID, it's kind of the same, kind of hard since we're not able to go out to clients. But I would say in a non-COVID world, in a normal world, going out to my clients is probably the most fun because I get to meet new people every day and work with great people every day, not only on my team, but our clients are great. And I love going out and servicing them too. So I think that's the best part about my job is being able to go out, talk about health, like the thing I love most, and educate. I think, it's so rewarding when I have a member that comes back to me and says, like, I want to thank you because, like, we found this, early on and we were able to catch it, or, I was able to lose this, or I got my sleep back on track, or whatever it may be. So it's the rewarding part about my job, and I really enjoy that.
Yeah. And sorry.
No, you're fine. The least, I don't think I have a least favorite yet. I don't think I've found one in the almost year and a half that I've been there. I don't think I've found a least favorite part yet. I think I try to see everything as a positive, even if I feel like I don't really like to do something. I'm like, okay, well, what is this going to do for me? And what am I going to learn from it? And I try to constantly see something as a learning lesson rather than, oh, I really don't like to do this. So I haven't found anything that's least exciting yet.
Wow, that's great to hear. So if anyone wants a great job with no downside, talk to
There you
Yasmin.
go.
She's
Yes,
got you.
absolutely. It's the perfect job. Or you know what? I always tell people it was the perfect job for me. So I think I love to toot the horn because I love what I do.
Yeah, and I'm glad that you are because it's not a job that people hear about, and especially in the organization that's doing the work, it's not something that is common knowledge. So I'm glad that you are speaking about it and that you do enjoy it, because I think going forward it'd be very important just to have those more prevention focused programs and
Yeah.
everything.
I definitely didn't envision working in insurance when I was in grad school. I was like, oh, insurance? Like, I didn't even know insurance had public health. But that's the great part about public health is it's so versatile that you can pretty much insert yourself into any industry type and succeed. You have the skill set. And just finding where you fit best and, bringing your skill set to the table so people are like, oh, wow, like, she knows what she's talking about. I don't come from an insurance world. I don't come from a business world, but I'm learning about the business world and I'm learning about the insurance world, but I do come from a health world and I can teach other people about the health aspect of it. So I feel like I fit in very well there.
Absolutely, that's really cool. So you said that you travel out to partners most of the time for your work. So is that like 90% of your work, or how much percent of your work is done like traveling, meeting with new clients and partners?
I would say about 70 to 85% of my job is traveling. So times like these make it very difficult, but we are trying to find other ways to still get people engaged and educate them. So thank God for all the virtual things we have. And technology, even though some people prefer the face-to-face interaction like myself, I still think that it's such a blessing that we still have options to kind of combat not being able to go out there.
Okay, absolutely. And yeah, agreed. We are living in the best time to be living through a pandemic, to be honest.
Absolutely.
Yeah. So what is the other 25%?
I would say the other 25% is doing my research, making sure I'm prepared to go to my client meetings, some admin work, presentation preparation. So since I go out there and educate, I have to constantly make sure my presentations are tailored to each specific community that I am, working with. So I would say the other 25% is probably my research portion of it.
Okay. And what advice would you give someone that has to like improve on their presentation, since it seems that you do a lot of those?
Yeah. I do a lot of them and I still have a lot to work on. But I would say, when you go out into the working world, when I was in school, I feel like, oh, we could be creative and put our little creative spin on things. But when you go out into the working world, they kind of have their own format of how they like to have their presentations presented for companies or organizations. When I worked at CDC, there was definitely ways that the CDC liked to do it. And when I worked at, Children's Healthcare, there was ways that they like to do it. So every company has their own way of kind of how they like to present. I will say one thing that I really love about my job is we have about 6-7 consultants on my team, and everyone has a different presentation style. And they encourage that. I learned something from one of them. Someone learned something from me and my presentation style. So I used to see it as, oh man, I'm not good at this. Like, I need to learn this from this person. But now I'm trying to see like, okay, well, I can offer this person like, this piece of advice when it comes to making presentations, and they can offer me this piece of advice. So I would say I try to keep my presentations very lighthearted depending on my audience. So I try to connect with my audience. I really want to get them engaged. So I ask them lots of questions during my presentation. I try not to cold call, but I'll usually sometimes if I see someone's falling asleep on me, I'm like, all right, let's get up, let's get active. So I like to keep it fun, very lighthearted during my presentations personally, because I've sat through insurance presentations and some of them can be very boring. So I was like, all right, how am I going to put a fun health spin? Because I want people to focus on the health aspect of this. So each one is different. It's really hard to say, but I would say put your own creative spin on things when you're making presentations.
Yeah, thank you for sharing that. So you said that you work with, I think you said 7 other consultants. So do you all work very collaboratively or more independently?
It's a little bit of mix of both. So we have our own kind of pod system is what we call it. So we're on sales teams, and we have like a sales executive to each pod. So one consultant has their own pod. Every consultant has their own. And, we are in charge of getting our clients in our specific pods engaged. But as a consulting team, we do meet up every week and we talk about like, oh, this is a group we're struggling with. And then, some other consultants will offer some advice. So we work with lots of different teams. We work on a sales team, we work on a consulting team, we work with brokers, we work with clients. So it's lots of different teams. So definitely a lot of collaboration.
Okay, awesome. Thanks for sharing. So I know before we started this before I started talking with you, that you said that you wanted to talk about comparing the right job to having the right partner. So I'm going to give you the floor to talk about having the right job, which is equated to having the right partner.
It's a funny analogy, but it really works. So I had a mentor in grad school, and I was definitely, when I was struggling during the job search process, I told him, I was like, I really don't know how to do this. Like, I don't know. Then he gave me this analogy that works really well. And I told him, I was like, can I borrow it? And he said, absolutely. So the analogy is finding the perfect job and the right job for you is like finding the perfect partner. So if, I am not an expert at finding the perfect partner either, but I see it as kind of the same timeline. So there's different phases when it comes to finding the perfect partner, just like there are different phases of finding the perfect job. In a partnership, you may date, and then you may be in a relationship, and then get engaged, and then get married eventually. In a job search, you're essentially doing the same thing. So when you're in the dating phase, what you're doing is you're trying out different industries. You're going on different dates, trying out different jobs, seeing what fits you best. Okay, so that's kind of like the dating phase. Then you eventually, start applying for jobs, and then you start going on interviews, and you're finding the job that like you're really starting to like, and you want to spend more time with, and you want to get serious with. So that's more of the relationship phase. And then from there, you're going to go through the engagement phase. You're going to get through that last interview, and they're going to offer you that job. That's the big ring moment. They're going to give you that engagement ring. It's a fat ring. It's a fat payday. So they're going to offer that to you. And then you're going to get married. You accept the offer. You're happily married and things like that. Now, something I always have, when when people ask me these questions, it's like, okay, well, that's all great and all, and you're married and all this other stuff, but what happens if that job isn't the perfect job for you? And that's okay. You know, just like sometimes couples get divorced or things don't work out in relationships and you move on, that's okay. You know, that relationship has served its purpose, that job has served its purpose and given you what you needed to move on to the next one. So I don't like to see like people leaving their job as such a negative thing, because it has given you what you needed to move to the next one. But you will find that perfect partner. You will find the one that, you know, fits you and your personality best, and what you're looking for in a job is, I think I always tell my mentees to do some soul searching, find out what you're looking for in a job, just like finding out what you're looking for in a partner. You know, are you okay with a certain job, like work lifestyle? Are you okay with, you know, professional and personal development? Like, what are you looking for? A small company, a big company, a long term, a short term. So definitely doing a lot of soul searching and sitting down and talking. I'm literally talking to yourself and finding out what you want is just like finding the perfect partner.
Thank you so much for sharing that, and I can't wait to share that with everyone else. I think everyone else is going to enjoy that too, and I think it is very relevant and it is very important. And I think that soul searching part is so important because, especially in public health, as you said, it's such a vast field. You know, there's so many different things you can do. So really finding out and looking to see what there is there, and what really drives you, and just beyond only the work, like, is the culture right for you, is the time, is like for you, like you like to get out and see partners and you do a lot of traveling, is that the type of role you want? And that's all things to consider when looking for jobs. So thank you for sharing that, and yeah, that was great.
Sure.
So
it's a great analogy. It works.
absolutely. So where do you see yourself in the future, or where do you want to see yourself in the future?
Oh, so that's a tough question. I feel like that's part of the soul searching I'm doing currently. So I told myself that I wanted to check in with myself between every 1 to 2 years, job wise, to see where my head's at. And you know, it's been a year that I've been out of school now, and you know, of course I miss school, but at the same time, I'm really enjoying what I do work wise. So I'm like, okay, what's next? So for me right now, I would say that I'm really trying to work on, at this moment, understanding the business side a little bit more. You know, learning from some of my colleagues that have MBAs, or some people that have been in the insurance industry for a little bit longer time than I have. That's definitely something I want to work on. You know, at the end of the day, health is also, you know, health industry is also a business. So being able to have business conversations is very important. So I think that's something I really do want to improve and work on in the next few years for sure. And you know, I would love to get back to some of my research. Like, I'm definitely still interested in doing some things in the realm of dental public health, and you know, seeing what that can bring me with my company. I definitely am married to my company at this point, so I don't see you know, any future with anybody else but the current company I'm with. I'm very happy, and you know, they have provided everything I'm looking for in a job, in a company, in a partner. So I definitely see myself with my company, and I'm curious to see where that path can lead me, because I think it's the opportunities are so vast when it comes to Humana and, you know, health insurance and the path that they're headed down, and population health. I mean, it's expansive.
Yeah, absolutely. Like, the healthcare landscape is changing a lot, and we're not sure where that's going, but it seems like Humana is in the innovative front, like focusing on that population health part. And I think that's something that a lot of public health students and professionals are probably going to get into some more. So what sorts of business acumen, I guess, are you trying to gain from talking to these people with MBAs and stuff like that?
Yeah, so since I work on a sales team, something I've learned about myself is my approach. I'm not going out and selling business. This is, you know, they've already gotten it. It's a package deal. I'm just doing what I can to provide the best quality of health for them. But when you want to increase engagement and teach people about health, some of it kind of boils down to selling people on it, and trying to show them the importance of something. So I think something I'm trying to learn is what kind of style of sales do I have? Am I a little bit more of an aggressive approach? Am I more of a soft approach? Am I somewhere probably in the middle? Am I someone that has to constantly look at the data analytics and the finances first? So it's lots of different things. I'm learning lots of different things with regards to the business side and the actuarial science behind it, the underwriting, all of it kind of works like a wheel for the whole thing to be successful.
Yeah, absolutely. And just healthcare industry in general is just so complex. So there's probably a lot to learn. And I think it's very important to start, especially public health professionals, not only looking at the human side of things, but the business side of things, because we need to be a driving force for the businesses that do make that change and do help those populations. So that is very important.
Yeah, absolutely.
Yeah.
I definitely see the importance of the health policy and the health management side of things. So definitely one thing I would say is if anyone has the opportunity to take courses in health policy and health management, that's always going to be needed in any healthcare industry. And it's an important skill, being able to just, understand the health economics, the health finance side of things. So I definitely wish I took more of that in my graduate school career, but something like yourself, you were health policy, so that is so important when it comes to insurance in general and all the different laws and policies you have to look at with regards to making sure everyone can get healthcare.
Yeah, that is true. Thanks for sharing. So what public health issue resonates most with you?
Oh, that's a tough one. I would say mental health is something I am a huge advocate of on all different levels. So when I was at Rollins, I was the secretary of our mental health alliance. And I've battled some mental health issues with anxiety and depression. So I think that is something I'm a huge advocate of, something that's probably becoming a little less stigmatized nowadays, which is great. But something that I feel like it goes undiagnosed a lot of the time. So I would love to get back into communities, especially like impoverished communities that I've worked with in the past. A lot of the underlying concerns are mental health issues.
Yeah, and that is so true. And especially with everything going on right now, mental health is definitely something that is taking a toll, and it's going to continue to be that way moving forward for the next couple of months at least. So definitely that is very important. So moving you along to the last section of the show, the Furious Five. So the 5 questions I ask all guests. So question number 1. What advice would you give to a student trying to pursue a career in public health?
I would say to be curious, ask questions always. Do not be afraid to ask a question. And to be open-minded and always willing to learn. I think those are all very important. There's no stupid questions. And I think curiosity strikes great questions, and always wanting to learn from other people. I mean, you're a lifelong learner in public health.
Yeah, absolutely have to be a lifelong learner. So number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
Oh boy. I would say being able to be versatile and flexible, I think, is one thing. Sometimes in health, in my position, or in healthcare in general, you have to be willing to put others before yourself. So being able to be flexible, I think, goes a long way with people. If you show them that you're able to work around their schedules, or kind of give them what they need, it shows that you care. So I think versatility and flexibility is one important thing. Effective communication, that goes without saying in any industry, in any field anybody's in. Effectively being able to communicate on paper, verbally, whatever it may be, is very important. And then I would say then never burning a bridge, creating those networks, those partnerships, and then just having a good attitude. I feel like if you have a good attitude and if you love what you do, that really shows in your work. So I think that's something that's really important.
Thank you. Number 3, what's something you're working on improving in your life right now?
So I think we touched a little bit on the business side of things. So I definitely am still trying to learn a little bit more on the business side of things of my current role. So that's definitely something I'm trying to improve. Going back to my grandpa's foundation and working more on that, I definitely want to do that more. And then something that, obviously I'm not in school right now, but I miss school all the time. So being a lifelong learner, I constantly want to stay up to date. So something I'm working on is certifications, whether it's public health certifications or business certifications. I definitely want to make sure that I'm doing as much as I can and being able to be as marketable as I can be.
Okay, thank you. Number 4, professionally, do you recommend anything?
A mentor or many mentors. Many mentors. I will say, looking back, I had fantastic mentors through my undergrad, graduate school, work, and I have many of them. I don't have just one because I go to each of them for something different. And I think they've all given me something that has gotten me to where I am today. So I think having a mentor or many mentors will make a huge difference.
Okay, thank you. And last but not least, where can people connect with you?
So people can connect with me on LinkedIn, and they can connect with me through email and on my Instagram page at withlove_Yas. And yeah, that's where people can, check me out and reach out. And if they have any questions, I'd be happy to answer them.
Okay. Thank you so much. And I'll be sure to put all that information in the show notes. Well, thank you so much for sharing everything that you did today, Yasmin. I really appreciate it. And I'm just glad to have you on the show and really, because just talking about like Humana in general, like I would have never thought that they were like public health jobs there. So just shining that light on that and on your job is very cool. So I'm very thankful to have you on the show today. Thank you so much.
Sure. I'm happy to share any knowledge and happy to be here. Thank you for having me.
Yeah, my pleasure. So thank you. And I will talk to you sometime soon.
Okay, that sounds great. Thank you.
You're welcome. Bye-bye.
Bye-bye. Bye.
Well, I'm really glad that Yasmin got on the show today to share her story in public health. It's really nice to always have someone who's a peer graduating the same year as me and just seeing how her story develops. So I'm really excited to look forward and just see what amazing work she does. I hope that you took some great value from this. If you are interested, I have launched some apparel on my website, so thepHmillennial.com. Just check that out. There's a store there that you can purchase some stuff to support the show because, as you all know, this is all me doing everything for the show, for my website, for my blog. So it's definitely a lot sometimes. So I appreciate you following this show, listening to this show, sharing this show, liking, subscribing, and all of that. But if you'd like to purchase and support me monetarily, that would be greatly appreciated. Other than that, I hope that everyone's doing well, and I hope to see you all, or hope you all see me and listen to me next week. Have a great week, y'all. The Public Health Millennial out.